Greetings, Dr. Carhee here with the public service announcement. Going to basically share some things with you about the reopening that's happening. Today is actually Friday. I believe it's the 24th of, of April. And I know Georgia is opening up. So now I want to share with you what are the criteria that they're looking scientifically as far as what are the best practices for opening up. So we're going to have a screen share here. I'm going to go over what I found, what I think to be helpful. And knowledge is power. So we're all going to look up what's there. Now, this has been provided for our consumption via, our White House, United States of America. All right, for better or worse, these are our leaders. So we should pay attention to the information that they have given to us. All right, here it is. It's Open Up America again. President Trump unveiled guidelines for opening up America again. Three-phased approach based on the advice of public health care experts. All right, these steps will help state and local officials when reopening their economies, getting people back to work, and continuing to protect American lives. And that is the goal, okay? So proposed phase approach based on up-to-date data and readiness. It mitigates risk of resurgence. It protects the most vulnerable and implementable on statewide or county by county basis at governor's discretion. Key thing there, and our governor has taken a liberal approach. So let's see exactly what this is proposing. Proposed state and regional gating criteria satisfy both proceeding and phase comeback, okay? Symptoms, downward trajectory of influenza-like illnesses reported within a 14-day period, okay? Onward, downward trajectory of COVID-like syndromic cases reported within a 14-day period. So that should be data, right? Cases, downward trajectory of documented cases within a 14-day period, and or a downward trajectory of positive tests as a percentage of total tests within a 14-day period. Flat or increasing volume of tests. How's our testing? All right, hospitals treat all patients without crisis care. And robust testing, there's that word again, program in place for at-risk healthcare workers, including emerging antibody testing. Now, I'm for that 110%, right? Emerging antibody testing, I think that's the way, but I'm not going to put my opinion in this broadcast. All right, so state and local officials may need to tailor the application of these criteria to local circumstances. Metropolitan areas that have suffered severe COVID outbreaks, rural or suburban areas where outbreaks have not occurred or have been mild. Additionally, where appropriate, governors should work on a regional basis to satisfy these criteria and to progress through the phase outlined below. Core state preparedness responsibilities, testing and contact tracing, ability to quickly set up and efficient screening and testing sites for symptomatic individuals and trace contacts of COVID results. Ability to test syndromic influenza-like illnesses, indicated persons for COVID, and trace contacts of COVID positive results. Ensure Surveillance sites are screenings of asymptomatic cases and contacts of COVID positive results. Our trace sites operate at locations that serve older individuals, lower income African Americans, that's what I was about to say that, racial minorities, and Native Americans. All right, that is a lot. Healthcare system capacity, ability to quickly and independently supply sufficient personal protective equipment and critical medical equipment to handle dramatic surge in need. Ability to surge ICU capacity. Okay, so you have to be expanded. How are we doing there? I think we're okay. But protect the health and safety of workers in critical industries. Protect the health and safety of those living and working in high-risk facilities, senior care facilities, for example. Protect employees and users of mass transit. Advise citizens regarding protocols for social distancing and face coverings. Monitor conditions and immediately take steps to limit and mitigate any rebounds or outbreaks by restarting a phase or returning to an earlier phase, depending upon severity. Now, guidelines for all phases, no matter what, okay? Individuals continue to adhere to state and local guidance, as well as, right, complementary CDC guidance, particularly with respect to face coverings. That's big now. Continue to practice good hygiene, always appropriate. Wash your hands with soap and water and use hand sanitizer, especially after touching frequently used items and surfaces. Can we say grocery store? Avoid touching your face. Sneeze and cough into a tissue or inside of your elbow. Disinfect frequently used items and surfaces as much as possible. Strongly consider using face coverings while in public, and particularly when using mass transit. People who feel sick should stay at home. Do not go to work or school. Contact and follow the advice of your medical provider. Put a pin in that one. All right. Guidelines for all phases. Employers develop and implement an appropriate policies in accordance to federal, state, and local regulations and guidance, and informed by industry best practices regarding social distancing and protective equipment, temperature checks, sanitation, use, and disinfection of commonly and highly trafficked areas. Business travel. Monitor workforce for indicative symptoms. Do not allow symptomatic people to physically return to work until cleared by a medical provider. Develop and implement policies and procedures for workforce contact tracing following an employee COVID positive test. So, this is where we are, right? This is where we're supposed to go. Well, this is where we are supposed to be in Georgia. And what should we be doing with phase one? Well, let's see exactly. For states and regions that satisfy the gating criteria, individuals, right? All vulnerable individuals should continue to shelter in place. Members of households with vulnerable residents should be aware that by returning to work or other environments where distancing is not practical, They could carry the virus back home. Precautions should be taken to isolate from vulnerable residents. Very interesting. Okay, grandma, them, all that. Individuals, when in public, parks, outdoor recreation areas, shopping areas, should maximize distance from others. Social settings of more than 10 people, where appropriate distancing may not be practical, should be avoided unless precautionary measures are observed. This is interesting and quite controversial. I wonder how we will handle that. We have our, I guess, orders to stay 6 feet apart, but will we if we relax this in phase 1? Avoid socializing in groups of more than 10 people in circumstances that do not readily allow for appropriate physical distancing, such as receptions or trade shows. Now, hopefully, this will not be taking place, but you never know. All right, minimize non-essential travel and adhere to CDC guidelines regarding isolation following travel. Now, that's new. If you go anywhere, I'm assuming out of the state, right? Nobody's really going out of the country. People's borders are blocked. If you go anywhere, they're suggesting you isolate. Look at what it said for employees in phase 1. Continue to encourage telework whenever possible and feasible with business operations. Okay? If possible, return to work in phases. Close common areas where personnel are likely to congregate and interact, or enforce strict social distancing protocols. No more break rooms, no more water coolers. That's my interpretation. Minimize non-essential travel and adhere to CDC guidelines regarding isolation following travel. Strongly consider special accommodations for persons who are members of the vulnerable population. A lot of us, comorbidities, elderly, okay? Specific types of employers, schools and organized youth activities, daycare, camp that are currently closed should remain closed. Period. All right. Visits to senior living facilities and hospitals should be prohibited. Can't see grandma and them. Those who do interact with residents and patients must adhere to strict protocols regarding hygiene. Please, Lord, let that happen. Large venues, sit-down dining, movie theaters, sporting venues, places of worship can operate under strict physical distancing protocols. Pastor must make sure that every member is seated at least 6 feet apart. And the pews, front to back, you must be 6 feet apart. How will that happen? Elective surgeries can resume as critical and clinically appropriate on an outpatient basis at facilities that adhere to CMS guidelines. Outpatient surgery, possible. Gyms can open if they adhere to strict physical distancing and sanitation protocols. But it says here, bars should remain closed. Interesting. Now, this is very interesting. I hope this has been helpful to you as it was to me. But please, let's follow these guidelines. And this is what they're looking at. And we'll see where we are in a couple of days, most definitely a couple of weeks. Here's to you and your family. Be safe and God bless.